Greetings. We welcome you to this educational video as we talk about the common challenges or complaints, if you will, in pregnancy and how to address those. My name is Dr. Jacob Curtis. I'm a physician at Grand Peaks Medical in Rexburg, Idaho. My background is in family medicine with an emphasis in obstetrics and also a background in emergency medicine. We've put these slides, this information together to try and be helpful to our patients and community members who could use this to be helpful to guide them and assist them in their pregnancy care. There's a disclaimer, which is that this is not to replace the advice given to you by your healthcare provider. If I am your healthcare provider, we recommend you using judgment and prudence and not just relying on these slides, but seeking out if you have questions or concerns. If you have severe symptoms, call 911 or go to your local emergency department. I like this slide because it reminds us of some of the challenges that might be experienced from one character to another. How's the pregnancy going during? Oh, just fine. If I could just ignore the backache, constipation, heartburn, nausea, vomiting, acne, aching feet, incontinence, exhaustion, etc., etc. Sound about right? Our pregnancy is an exciting time. It's a wonderful time as you look at expanding your family, bringing a new family member in, but there is a fair amount of discomfort along the way as your body goes through different changes to help support this new life. So we're going to talk about some of these things and how we can help to address those symptoms and make your life more tolerable. Nausea and vomiting is very common during pregnancy. Affects over 2/3, oftentimes begins by about 6 to 8 weeks, sometimes sooner, sometimes later, and may continue 13 to 16, although I have some patients out there who can attest that for them, unfortunately, many, at least some, can experience it beyond that 16 weeks. Most common in first-time moms, those who are young, actually non-smokers, not that we encourage using tobacco use to subsidize these symptoms. Uncomplicated nausea and vomiting is associated with improved pregnancy outcomes, but it doesn't negate some of the other challenges that might be experienced. Oftentimes, it's easy to blame the pregnancy hormone responsible for the nausea and vomiting, also known as progesterone, but the reality is there's another factor too. As your body's going through increased metabolic demands, using more glucose to help this beautiful life develop inside of you, your blood sugar can also drop. And oftentimes, many patients can experience hypoglycemia-induced nausea and vomiting, and it's not just all pregnancy hormone related directly. In our office, we often use the following algorithm or recipe or approach, if you will. Usually we start with non-pharmacotherapy options. Pharmacotherapy is a medical word for medications, either prescribed or over the counter. These might include ginger, has a lot of popular press in recent years. That can be taken. Bonine or Dramamine has a non-drowsy version, which is essentially ginger capsules. That can be safely taken, otherwise natural product. You can also try some over-the-counter medications. Vitamin B6, also known as pyridoxine, can be taken up to 3 times a day. That can help many patients. Doxylamine, also known as Unisom, historically a sleep aid, also very safe during pregnancy, can be taken at night before bed and have some residual benefit to lessen the nausea and vomiting you might otherwise experience in the morning. Antiemetics, which is a doctor word for nausea-preventing medications, can be prescribed by a healthcare provider. Often used are promethazine, also known as Phenergan, sometimes Reglan, also known as metoclopramide, and Zofran, also known as ondansetron. Phenergan can be a little bit more sedating. It's basically an antihistamine, kind of in the same general family as Benadryl. Zofran received a little negative attention a few years ago, but it's still very safe during pregnancy. There was a small Norwegian study that highlighted some concerns. It was a higher dose, higher frequency. There was a concerning finding. We're pleased to report as of December of 2019, 10 years of data came back with 1.5 million patients, further establishing the safety of Zofran. So it can be taken. Please consult with your healthcare provider. It does require prescription. Not all may be comfortable, but we try to stay progressive and up to date, and it does look like it has an appropriate and safe role in pregnancies. If somebody is taking one agent and it worked for a while and it's no longer working, please consult with your healthcare provider. It can be changed around. In some severe cases, our patients require either temporary peripheral access. We can give them fluids and nausea medications in the office if you're just, despite the oral meds, unable to keep things down. In some severe cases with weight loss, severe signs of dehydration, electrolyte abnormalities, they may require hospitalization or a permanent IV. Here's some non-pharmacotherapy options that you can try. Crackers, I'll joke with my patient, make sure you eat them on your spouse's side of the bed so you don't get the crumbs on yours, so you can sleep better at night. You want to rise slowly the next morning so you're not shifting too quick. Small and frequent meals, protein-containing snacks, avoiding greasy things that can make the nausea worse. Try to be kind to your support person. They love you, they care for you, but you'll notice some smells that previously were not aversive can become very aversive. And then changing things around and the timing of when you take your prenatal vitamins. If they're still too nauseating, there's different forms that might be more tolerable. We talked about ginger already. This is something that has received some support in the complementary alternative medicine literature. Acupressure follows different pressure points, and that can be helpful for some. There's not a ton of evidence on it, but the risk of harm with it is so low that feel free to use that as an adjunctive therapy as well. They make those C-bands that you can wear on your wrists. And we've also talked a little bit about when to hospitalize, and this slide highlights that. Another common complaint during pregnancy, also in the digestive tract, is GERD, also known as gastroesophageal reflux disorder. I want to step back for just a second. Why do women struggle with all these digestive tract symptoms? It's how the body works during pregnancy. The miracle of it all is this, that your body produces a surge of progesterone, which slows down your digestive tract. And the marvel and the miracle of the body's creation, that is done so that it can ensure that your body is getting adequate nutrition. The GI tract slows down, so no matter how few calories you get in the history of the world, and for many of those who've gone before us, they were very calorie deficient for thousands of years. It would ensure that that baby was getting adequate calories. So that's the miracle of it. The downside is today, when we're less calorie deficient, we can experience nausea and vomiting in early pregnancy and sometimes later, heartburn, constipation, gas, and the like. So reflux is something that we usually see more in the second and third trimester, although it can show up earlier as well. What happens during pregnancy with those hormones and proteins your body's producing, it can relax that lower esophageal muscle. The stomach can get displaced as your uterus grows larger, causing heartburn, which may have been previously non-existent, to be a perplexing problem and significantly adversely affecting our patients. Well, what are the non-medication options that you could try first? Try to avoid overeating, being cautious with things that are spicy, tomato-based, onion, peppers. We all love those, many of us love those foods, but that can make it worse. Try not to eat too close to bedtime, really giving yourself some time to digest, things that you could get away with before. Things that are citrus, grapefruit, lemon, orange could trigger it, mint, chocolate, caffeine, all the good stuff in life. Those can also serve as triggers. What can you do first? Beyond behavior modification, antacids, over-the-counter, Tums and Rolaids, super, duper safe during pregnancy. You can try those. If that still doesn't work, you can try some over-the-counter Pepcid, also known as famotidine. Your physician can also prescribe prescription strength that your insurance may cover. That's usually the second line. That's in that category of histamine 2 receptor inhibitors. Famotidine seems to be the safest right now. There's been a recall on some ranitidine. And then lastly, the PPI stands for proton pump inhibitor. This is also a prescribed medication, some of which are safer, some are less safe in pregnancy. It just tells your body not to produce as much acid. Probably the most well-known and safest during pregnancy, if that becomes necessary, is Prevacid. So consulting with your healthcare provider so they can help to make you more comfortable, but doing what we can on our own with that first category as well. Constipation, as alluded to a few moments ago, is a common problem in pregnancy as well. Things that can make it worse if you're on iron in your prenatal vitamin. Iron can help to prevent anemia, but it can also make the constipation worse. So if you're having significant symptoms, please consult with your healthcare provider and discuss whether or not the iron is still necessary. There are several other things that you can do. Non-pharmacologic measures, increasing your hydration, avoiding caffeine, which is a good pregnancy recommendation anyways, increasing the fiber. Exercise is a great cathartic to get the GI tract moving also. Stool softeners that are safe during pregnancy are Colace, which is docusate sodium, Miralax, cinnamon milk and magnesia can help too. Laxatives you have to be really cautious with, and as a general rule, recommend avoiding. Why? Because they can cause premature uterine contraction. So discuss with your healthcare provider before proceeding with those. Hemorrhoids, which are also not an infrequent part of pregnancy, can occur quite commonly. both in latter pregnancy and from the delivery itself, can be quite uncomfortable. Described as little nodules that come around the anal opening, can cause some pain, discomfort. One of the best things to help resolve or prevent hemorrhoids from occurring in the first place is decreasing strain with defecation. And so not spending more time on the commode, scrolling through Facebook or on your phone, kind of get in, do your business and get out, but also keeping your bowels as loose as you can within reason. Kegel exercises, kind of squatting, strengthening exercises can help. Sitz baths, which is when you fill the bathtub with warm water, sprinkle some Epsom salt in there, that can help. And then there's some over-the-counter preparations that can also assist with alleviating that discomfort. Usually they'll get better over time. If they persist even after delivery, that's something to bring to your healthcare provider, and there are some different procedural options that may be available. There's a little cartoon that highlights some of these symptoms that we've spoken about. Round ligament pain is a common part of pregnancy, described as a sharp lower abdomen pain either on both sides of the right and left lower quadrant or one or the other. You need to be careful to make sure we're not calling something round ligament pain. That could be something more serious like appendicitis, but round ligament pain is definitely more common than appendicitis during pregnancy. Can be uncomfortable, usually worse with spasms and sudden movement. What can you do to prevent it? It says on the slide, treat with warm bath, local heat, but I always think starting with stretching, good flexion extension exercises as a regular part of your daily routine can help to prevent it. Cool compresses, different stretches at home. We call them like this, the cat stretch or the superwoman stretch. You can look those up online, can be helpful. We try to avoid medications, although if it's really pronounced, you could try some Tylenol for that. Backache, super common during pregnancy. What happens is your body is stretching and changing. Your body's producing more of a chemical called relaxin that can cause your lumbar spine to kind of sway and develop what we refer to as lordosis. There's different stretches that you can do. In our office, we also provide osteopathic manipulative therapy. Usually my favorite is to not only demonstrate the stretches, but to bring their support person, be the spouse or their partner, and so that they continue some safe stretches at home to alleviate the discomfort when it arises at home, not just in the doctor's office. Here's some treatments. I'm not going to go over each of those bullet points. You can read that on your slide of some other things that can help there. Leg cramps can also be a common pregnancy. Oftentimes we're quick to reflexively say low potassium, which could be playing a role, but calcium may also be low. It says that there's no evidence for calcium, but you might consider taking some Tums or Raloids, which are calcium carbonate. For some that can help. Stretches, you do want to be cautious that the leg cramps are a sudden development. It's one side and associated with swelling. You want to consult with your healthcare provider just to make sure we're not missing a blood clot, which has an increased possibility during pregnancy. Varicose veins, more frustrating and unsightly cosmetically for our patients, usually go away afterwards. In and of themselves, not a reason to be alarmed for a cause of blood clot unless new, deep, proximal or upper leg and swelling. Here's some things that you can do to help out with the varicose veins on those slides. Usually they do get better after delivery. If they persist, talk to your provider, and there are some procedures that can be done to help. Leg swelling is super common during pregnancy. In and of itself, it doesn't mean anything's bad necessarily, especially if it's both sides. Worse after being on your feet all day, goes away with rest. But again, if it's one side more than the other, blood clot might need to be ruled out. And also, keep in mind, it's about 70% of OB patients. So leg swelling is okay, but if you start having arm swelling, facial swelling, that could be a risk factor for preeclampsia. Especially if you had a headache associated with that, you probably need to consult with your healthcare provider and get your blood pressure checked just to make sure. But what can you do about that leg swelling? Support stockings, compression stockings, either knee high or thigh high, depending on your symptoms, can help. Getting those legs up, proper foot and shoe wear can assist too. And one thing that's interesting is we think that when you feel edematous or water retained, it's because you're drinking too much. Oftentimes that's the body's response when we're not getting enough. And so adequate hydration with non-caffeinated beverages can help. I'll let you read that cartoon on your own. Symptoms to evaluate during pregnancy. These are things that might need some attention. If you had a little spotting with mucousy discharge, that's okay. But if you had heavy bleeding, painful bleeding, that needs to be assessed. Decreased fetal movement. Fetal movement is a sign of fetal well-being, but Early on in pregnancy, we're just still calibrating. Usually once you get to be about 25 and for sure 28 weeks, that's when we want to be more aware. So a lot of my patients are first-time moms. 18 to 20 weeks is usually we're going to have awareness of that fetal movement, also known as quickening for the first time. Just enjoy it when it comes, but it may not be every hour in that 20-week mark. But once you get to 25 to 28 weeks, want to be feeling baby move on average at least every hour. And so if you haven't felt that movement, get your feet up, drink something cold, listen to some soft tunes. But if you still don't have confidence of fetal movement within half an hour, please don't feel like you're being alarmist. Call your healthcare provider's office, your OB provider. They'll most likely put you on monitor in the office, make sure all is well. If it's after hours, weekends, holidays, go to labor and delivery. Swelling we already talked about, but specifically facial swelling, headaches could be a symptom of preeclampsia, and that should be assessed. Visual changes that are new and different. Contractions we've previously talked about in other slides, it bears worth repeating. It's described by those who've experienced those as cramping, like a menstrual cramp, comes and goes, builds up, and then lessens, kind of like a crescendo, decrescendo, lasting 30 to 60 seconds. Throughout the day, from time to time, with activity, exercise, recent intimacy, it can occur. But if it starts to get closer together, less than 10 minutes apart, going on for more than 20 minutes, that probably needs to be checked out. And lastly, leakage of fluid. That suggests a need, or the concern there is rupture of membranes, which is fortunately pretty rare. That's where your amniotic sac leaks the amniotic fluid, which could precede immediately preterm labor, increased risk of infection. Fortunately, that's pretty rare. 1% of women will have the water break on its own before 37 weeks, and only 10% after that. Most of the time, it's in labor and delivery with the assistance of your OB provider. And so how would you know? It's not just a little mucousy discharge, it's a significant amount in most cases. Usually a cup or more of kind of a salt-smelling solution goes through underclothing down legs. If you're not sure, put on a liner, see if it continues. But if it's a very watery, large amount, that needs to be checked out. If it's just mucousy discharge, that's okay. I like this cartoon. Yeah, doc, I think my wife is ready to have the baby. Her contradictions are only 30 seconds apart now. Husbands, spouses, you may keep that to yourself. And so that's a brief overview of some of the common challenges and complaints that we might experience, some strategies that you might incorporate. As always, if you have concerning symptoms that aren't responding to some of these mild interventional measures, please reach out to your OB healthcare provider. Thank you for your attention.